Good morning, everyone. My name is Senator Mary Darty Abrams, and we are now convening the Public Health Committee meeting for January 25th, 2021. We'll move right on to item 2, which is remarks by the chair, and I will turn it over to my co-chair, Representative Steinberg, for remarks.
Thank you, Madam Chair. Good morning. I hope everybody had a nice weekend. Our goal today is to raise some more bills. Just a reminder, we are not intending to rehash any of the conversation we had on previously raised bills. And our goal is not to focus on the merits of the legislation. We're glad to explain and describe them, but the idea is not to engage in an extended debate. Thank you, Madam Chair.
Thank you, Representative Steinberg. I just want to mention before we move on that I noticed that everybody when they came on are muted, and I greatly appreciate that. Really helps in keeping the background noise down on the meeting. So thank you. I know Representative Pettit's here. If you have any opening remarks.
No, ma'am.
Ranking member. Thank you, sir. Senator Wang, do you have any opening remarks?
No, madam. Glad you're feeling better.
Thank you. So nice of you. Is Senator Summers on? Do you have any opening remarks, Senator Summers? Okay, then we will get started. We'll move on to number 3, concepts to be raised. I want to be very clear as to how we're going to go about this so that everyone has an understanding. We have some new members on, and I just want to make sure everyone feels comfortable with how we proceed. So I'm going to start by going through each of the 1 through 9 and give a brief explanation of them, along with my co-chairs and ranking members and anybody else who I call on to help with the description, if appropriate. And at the end of that description, I'm going to make a motion to raise these concepts 1 through 9 with a voice vote. We will have that motion if made and seconded. At that time, anyone who has any objection to any one or all of these being raised by voice vote will then have the opportunity to raise their hand and express that objection. So I want you to know that that's the procedure. It's certainly open to anybody having an objection. So I don't want you to feel as it moves through that somehow it's moving and you want to make an objection. You will have that opportunity. So let's start by going through the concepts to be raised. Number 1, let me also make this clear. These are concepts at this point. The language has not been written. However, the language is written before this goes to public hearing, which is the next step. So there will be clear language going into the public hearing. One of the positives about doing these Zoom public hearings is that these are posted 5 days in advance. So people will have an opportunity to see that language well before the public hearing. And I think that's a real positive of this new process that we're in. So,
excuse me, Madam Chair, one interruption. I'll just disagree slightly. We also have the ability to have public hearings on bills that are merely concepts. They don't necessarily have to be fully fleshed out before a public hearing.
Oh, I apologize for that. Thank you for correcting me, Representative Steinberg. I appreciate that. So bill number one on our agenda is an act concerning long-term care facilities. As we all know, both from our involvement with agencies and most particularly with our constituents throughout this pandemic, we know the devastation that's happened in our long-term care facilities due to COVID. And so this concept is in response to that largely, to look at what are some of the issues that came up that were either already there, but just became exacerbated during the pandemic, or were the result of the pandemic. We've had a lot of discussion. We had a working group happening this fall that came up with some recommendations. I've seen some proposed bills come through that also are response to the situation that happened in our long-term care facilities. So we want to keep the concept open so that we can give voice to everybody who has some input to that. So that is the first concept to be raised. The second is an act concerning the recommendation of the Office of Health Strategy regarding revisions to all payer claims database program statutes. That is about the fact that although our Office of Health Strategy, who looks at data to analyze and see what the overall access is for healthcare in our state, they currently do not have access to the workman comp claims, which are sizable. So what they're looking for is to have access to that information so that they can incorporate it into their overall database and have a better, clearer, wider understanding of what's happening in our state in terms of healthcare access. Number 3 is an act concerning the recommendation of the Office of Health Strategy regarding revisions to the statewide health information exchange statutes. This bill is about looking for providers who are currently using the health information exchange program to have the opportunity. It is a request, not a requirement, to ask people to give them demographic information on race, ethnicity, and language, and then share that information. Again, to look more broadly at where access is happening, where there might be impediments to access. So that's what that bill is about. Number 4.
Madam Chair, I see a hand raised, Senator Wong. Is it important that you interject at this moment?
No, I just wanted to give some context to it from the standpoint, and I wanted to extend my compliments.
Can I just say, Senator, can we go back to that when we ask for discussion?
You bet. Thank you, ma'am.
Much. Okay, so we're going to move on to number 4, an act concerning various revisions to the public health statutes. We are in ongoing discussions, we being the leadership team, both chairs and the ranking members, vice chairs, with the Department of Public Health to look at some proposed bills and some bills that we had in our committee last year that they might either decide can be taken care of in a different way rather than legislatively, or they might be able to include it in their own public health bill as they move forward, or we might need to bring them up separately. These are bills, I'll give one example of newborn screening that would be in that section. So we felt that we needed to have some kind of an opening so that if there were things that we felt as a leadership team that was important that public health either could not, would not, or has not already taken on, that we could include it there. The next one is an act concerning healthy homes. Representative Steinberg, I will leave you to explain that one.
Thank you, Madam Chair. This concept bill is the product of a study that was done by the state as part of a federal grant on healthy homes. And the report provided data and conclusions that are frankly not a surprise to most of us. That many of the conditions in residents in the state of Connecticut lead directly to significant health impacts. And the purpose of this bill ideally is to create a pool of funds to be allocated across the state to address many of the healthcare related environmental factors in homes, which include lead paint, pest contaminants, problems with HVAC systems, energy efficiency. One could argue even the impact of food deserts have on diet in the home. But to address a broad scale problem and need in the state of Connecticut to address problems in the homes that are directly related to healthcare impacts. Hopefully the hearing will reveal both more opportunities and also, importantly, effective programs going on in the state that should be supported or expanded. I hope that suffices, Madam Chair.
Thank you, Representative Steinberg. That was an excellent explanation. Number 6 is an act concerning deceptive advertising practices of limited services pregnancy centers. This is a bill that this committee has taken on previously. In 2019, we passed it through the committee and it was actually passed through the House of Representatives. However, it was not brought up in the Senate. We had had it for our agenda in 2020, and we continue to be committed to following through on this bill. The idea for new members is that there are some crisis pregnancy centers, and I stress some, and that have been using deceptive advertising as a way to have young women, perhaps, and that's what we have to look at in this bill and through the public hearing, come to their center under conditions that they think exist but do not exist. So we want to make sure that women are given the appropriate information when they're looking for reproductive health care. And this is just one vehicle that we have to look at to make sure that we're doing that. Number 7 is an act concerning water quality notification. That bill addresses the fact that if you are a owner of a property, you get a quality notification from the water company, the water department, to say what they tested for, what the results were. If you are a renter or a tenant of that building, you don't get that information shared with you necessarily. And so we want to look at that practice and make sure that those people who are actually using the water are receiving the information about the quality of that water. So that is what number 7 is about. Number 8 is an act concerning allowing advanced practice registered nurses and physician assistants to issue home health orders. Representative Pettit, would you like to explain that one? You could probably do a better job of it.
This is referring to, especially during the pandemic, healthcare workers are quite stressed and stretched thin. This will allow APRNs and PAs to issue home healthcare orders without having to wait for, if they're not an independent APRN, PA waiting for the okay from a supervising physician will expedite getting people into home care and decrease the workload overall. And Senator Summers, anything you would add to that?
Yes, this is a very important bill because right now, PAs and APRNs that are doing primary care for the most part, they basically cannot write an order if you have a wound to go have a VA nurse come in and check on you. This would allow them to do that. What's happening now is they have to wait and fax the information over to a primary care doctor, and there's a delay in care. So this was authorized under the executive order during the pandemic, and it's something that we have been trying to get passed previously, and it's just shown in the pandemic how valuable it is. So it's a really important bill that we continue forward. There's also a PA bill that this is included in, should that come forward, and that was all agreed to by the Medical Society and the Hospital Association. So it's a good bill that hopefully she'll pass.
Thank you very much, Senator Summers and Representative Pettit, for that explanation. Number 9 may look familiar to you because we voted on it in our last committee meeting. It is an act concerning the education and training of coaches and the exertion of heat illness. We are in the people business, and there was a clerical error in the way that this bill was written. So we are dealing with it by reintroducing it so that it gets the right language attached to it. So this is a bill that this committee just looked at in our last meeting.
Clarify, Madam Chair, just to be clear, this has a different bill number as is required.
Yeah.
It is effectively a separate bill with the same intent, but it has the correct language.
Thank you. Thank you for that, Representative. Now, before we go back, I just want to give Senator Wang a chance to speak. You wanted to speak on the number 3, I believe it was, the Office of Health Strategy regarding revisions to statewide health information exchange. Senator, thank you.
Thank you, Madam Chair. And I just wanted to compliment the chairs for the dialogue in screening and being cognizant of some of the racial ethnic groups that were concerned about the issue of data disaggregation. And we are reaching out to the various interested ethnic groups to get their input and to re-emphasize that this is a pure look at data from a standpoint of healthcare delivery, particularly in the COVID pandemic environment, to be able to help the Office of Healthcare Strategies to look at pathways of providing service and support. But at the same time, I do want to acknowledge that as we move forward in discussions on this issue, that we are extremely sensitive to groups concerned about data disaggregation for purposes other than healthcare data support. So I just want to put it out there as public thought and appreciate the chair's consideration of the input of other people in this. So thank you.
Thank you very much, Senator. I just want to say too that I think this is when bipartisanism works at its best advantage. And I thank you so much for your help with this and showing that we can all work together. I think the pandemic has shown that data in this healthcare agency is crucial if we're really going to make sure that access to healthcare is equitable. So I too am very interested in hearing everybody as we move to a public hearing and hearing everyone's concern and making sure that we're addressing those concerns. So thank you so much for your work on this. I do greatly appreciate it. Representative Claritas Detria.
Thank you, Madam Chair. I'd just like to say thank you for addressing the heat illness bill and getting the correct language. We work very hard on that, so it's important that that everybody has the correct language. And my question on the pregnancy centers is there, I understand as a concept, but that we didn't have the language maybe from last year in there already to take in a hyperlink to take a look at.
I'm going to hold on that one because until we move it, we might be discussing that one and we'll bring that up then, if you wouldn't mind.
Thank you.
Okay. Senator Summers.
Yes, just a quick question. I apologize. I was a few minutes tardy because I was on another Zoom. Could you just give me the synopsis on how we're doing this? You're going to read them all, then are you going to read them individually or all as one? Really quickly, sorry.
And I want you to know that I apologize too. I would have called on you for the other bill, but I didn't because I didn't know that you were on yet. So, so thank you for joining us and helping explain that bill. I appreciate that. So what we're going to do is I am going to ask for a motion to raise these concepts 1 through 9 with a voice vote. If that motion's moved and seconded, then if anybody has any objections, one or all of these being done in a voice vote, they can then raise their hand and we will go through any ones that are objectionable. Does that explain to you?
So are you going to pull out the ones that are objectionable then?
Correct.
Okay.
Then if there's any that are objectionable, then I will also have the people who made the motion and seconded the motion withdraw those. And then we'll go back and look at which ones are objectionable and move from there.
Okay. So how do you know they're objectionable on a voice vote? Sorry.
Because I'm going to make the motion to have the voice vote. We will not do the voice vote. We will make a motion, have it seconded. I will ask if there's anyone who has objection. If anyone does, they can raise their hand. I will call on them. At that point, I'm going to ask that they just say which one they object to. We won't discuss it at that point. We will pull those out, or if it happens to be all of them, we will pull them all out. If there's an objection, then we need to withdraw the motion because the motion is for all of them. So we'll withdraw the motion in the second. We'll go and see if we can do any of them by voice vote and go back to the ones that are objectionable. So we'll have to see how many are objectionable, I guess, is the end result. But
Okay.
we'll keep moving.
I just missed the process. I just wanted to understand the process.
No,
Thank
that's
you.
good, because I'm sure other people came on later too. So I'm glad you asked that. So we are.
Madam Chair, I move that we raise bills 1 through 9.
Second.
Thank you. Thank you, Representative Steinberg. And then Representative Scanlon, seconds. Thank you. Are there any objections to raising 1 through 9 with voice vote? Senator Summers.
Yes, I will have to take objection to raising the pregnancy center bill. I would like to have that be a roll call vote. And the reason for that is it's probably like 5-fold, not 2-fold. First,
Can we, Senator Summers, can I wait for a minute? And
Sure.
you can explain that when we go back to it,
okay,
because your objection is good enough. Representative Pettit?
Same objection, Madam Chair, all set.
Thank you. Senator Wang?
Yes, ma'am. I would actually like to have a little bit more of a robust discussion on item number 5. The reason for that is I know we initially
You don't-
talked about.
Senator, you don't need to give a reason
Okay.
now.
Thank
Your
you, ma'am.
objection is good enough.
Thank
Are
you.
there any others that people have objection to at this point? I'll give you a moment. I know that there are some people who are between meetings, and I want to make sure everyone is given the opportunity. So we'll wait for a moment and see if anybody else would like to make an objection. Representative Jenga, if you could please put yourself on mute, I would appreciate that. Thank you, sir.
Senator, I move to withdraw my original motion.
Thank you. Representative Scanlon, do you also withdraw?
I withdraw, Madam Chair.
Thank you. Okay, so I would now like a motion to raise items 1 through 4 and 7 through 9, if there is no objection, by way of a voice vote.
So moved.
Second.
Senator Summers, Representative Steinberg, thank you.
Are we going to introduce 5 separately? There was
Yes.
no objection to 5. Okay.
No, there was an objection to 5, I believe.
Yes.
Yes, there was an objection to 5. Please raise your hand if you want to say something. It just helps the process better, okay? Thank you, Representative. Okay, again, I'm just pausing a little bit to make sure everyone has the opportunity as they move between meetings. So,
Can we
Since
have the
there's no-
administrator read out the bills that are going to be for a voice vote?
I don't know that we need to do that, but
Just
I
for formality's sake?
since we already reviewed them, I think we're good to go. So we have bills 1 through 4 and 7 through 9 for the vote without objection by way of voice vote. That's very difficult to say. So if everyone would please take yourself off mute and turn your camera on. All in favor, aye.
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 Opposed? Thank you very much. Okay, let's move to items 5. Let's start with item 5, since there was an objection to that one. For a voice vote, we will be moving for this one to a roll call vote. Is there any discussion before we move to a roll call vote on item 5? Healthy homes. Senator Wang.
Thank you, Madam Chair. And I applaud.
I'm so sorry to interrupt you, Senator. I apologize. I just want to remind everyone to go back onto mute if you haven't already done so. We take ourselves off mute for these votes and then forget to go back on, which is totally understandable, but I don't want anyone noise interrupting you. I want everybody to be able to hear you. Thank you so much. Go ahead, Senator.
Thank you. It seems like you're really getting the hang of this, Madam Chair, and the flow. So thank you. I raise this point not to oppose it. I think I'm looking for a much more in-depth description because, and to allay my confusion on this, to be honest with you, because in our discussions, we had talked mostly about our schools and ventilation and healthy context as it relates to that. And I must admit, I was slightly surprised when the agenda showed as healthy homes. And I was even more confused when the good chair who raised the bill began the discussion about a whole extended array of healthy considerations as it relates to living environments, which now extends to a home in addition to the school discussion. So I think I raised the question of having a little more dialogue because I want to understand a lot more of how wide the scope of what the proponent of this bill is looking at, and that we would have to have a much more in-depth discussion in regards to the concept. So if I may, through you, Madam Chair, to get the proponent of this bill to explain a little bit why the change from a school-focused kind of health environment, which is absolutely critical and I'm very supportive of, to move from now all aspects as it relates to private residences and homes to that context without a lot of background and engagement with ranking members in this. I guess it's a point of surprise, and through you, Madam Chair, I'd love to hear from the chair proponent of this a lot more why the rationale to make that change.
Thank you, Senator. I just want to add something before I ask the representative if he'd like to make any remarks. Let me say a couple of things. Number one, we do, as you pointed out, have an indoor air quality bill that we raised in our last meeting that is directly related to schools. This is, I do remember us discussing this in our screening. So if it wasn't clear enough, I apologize for that. If there was some kind of confusion about what was what and how it was done. And we'll make sure that we're clearer about those things moving forward. So I'm sorry if there was any kind of confusion that I was a part of. Secondly, I would like to say that there will be plenty of time when the bill is written and it has a public hearing to have a discussion on the merits of the bill. This conversation is about whether or not this bill should even be taken as a concept to be raised and considered and moved through. So we don't need to be debating the bill itself at this point, only the idea of whether or not it deserves to be moved forward. And we will be having a roll call vote to decide that. So I just want to be clear about that for people who are watching. Representative Steinberg, did you have any remarks you would like to make?
Yes, thank you, Madam Chair. I too will apologize if there's been any confusion in screening as to the intent and nature of this bill, leading the good senator to have conflated two totally separate bills that have commonality in terms of taking care of the public health. We have a bill that addresses problems with environmental quality in schools. This says pretty explicitly in the title, healthy homes. And even though it involves similar issues such as with HVAC systems and other environmental conditions, it is focused on healthy homes. I had hoped that my initial description was sufficiently clear as to its intent. To the senator's point, there are several, if not many, different issues relating to people's homes that have direct impact on the family's health. This is intended to create an opportunity for us to support such efforts such that we can ameliorate many of the problems we have in our state with aging homes that are sources for all sorts of contaminants and other health-related issues. I hope that suffices. To the chair's point, this is at this juncture a concept bill in order for us in the public hearing to become more aware of good programs and good ways of going about doing this. As I said, it's also predicated on a state study that was funded by the federal government. There is science behind this. There's certainly a need. We're seeing if we're in a position to address it. Thank you, Madam Chair.
Thank you, Representative. So if there's no other comments on that, oh, Senator, go right ahead.
Thank you, Madam Chair. I just wanted to do the protocol raising the hand, and I wanted to thank Chairman Steinberg for his explanation. And I do agree with him in regards to the consideration of health risks that exist in our home, lead poisoning, air quality. These are important, critical issues. I just wanted, for the sake of this Zoom world that we're in, and for such a critical and important issue, that as we raise it, we wanted to be able to alert shareholders that are very interested in this issue to identify this as an important bill to debate and offer their context. And for me, I didn't have a full understanding of it, and I did confuse it with regards to the school quality bill. And that's why I wanted to point out the point of clarification and transparency. So I want to thank the chairman for explaining it and the opportunity for me to raise this question. I will be in support of this to hear more about it. But again, I appreciate the opportunity to raise this question. Thank you, Madam Chair.
Thank you very much. There's some people with their hands raised. If you're raising your hand, I hope it's to comment on this particular bill. So let's start with Senator Summers.
Yes, I just wanted to say that I will support this going forward. I look forward to seeing some of the information that will come out of this. And I haven't read the report, so I'm looking. Could you send that report to everybody, Jonathan?
I'll put my hands on it and make sure all committee members get it.
Okay. My only concern is I'm not interested in mandating anything on homeowners or landlords that are already stressed, but I do think it's important that we know what the environmental factors are that can affect our quality in our homes. But I think it would be really helpful for all of us if we could get a copy of that report, to kind of put what we're trying to do in context.
Glad
And
to do
I
it.
support this out of committee for a concept. Thank you.
Thank you, Senator. Representative Pettit.
Thank you, Madam Chair. So I'm assuming this raising multiple concept, but as we're all well aware, the rate limiting step will be a funding source, which at the moment, I'm assuming we don't have identified.
Thank you. Representative Dolphinaeus.
Hi, good morning. I'm just wondering, is this bill going to require or allow or mandate that the government come in and investigate personal private homes?
I think that would be a question that would come up during the discussion and during our public hearing. I don't believe that's what it would be, but what the bill will be will come out of our discussion in hearing the public hearing and our discussion as a committee in later on, if and when the bill moves forward. I want to say that I agree with Senator Summers in that it's a discussion worth having and information for this committee to hear.
Madam Chair, if I might.
Sure.
As proponent of the bill, I want to reassure the good representative that there's no intention to have governmental intrusion into people's homes. If anything, it is to facilitate their ability to maintain a healthy home. It is not intended to mandate it as much as it is to make it possible. Thank you, Madam Chair.
Thank you, Representative. I don't see any more questions. If the administrator will get ready for a roll call vote. Again, I want to give everyone the opportunity to come back if they're at another meeting or so just to notify everyone, we are going to take a roll call vote in a minute. Please make sure that you're on mute till the administrator calls your name. We have some people who are off mute and causing some interference. So if we can please make sure that everyone's on mute. Thank you. The administrator will call your name. You need to be on the camera. Please state your name and what your vote is when you are called. Ms. Henry, are you ready to start? Okay, I'm sorry, go ahead.
Dorothy Abrams.
Senator Mary Darty Abrams votes yes.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar.
Senator Anwar votes yes.
Senator Kushner.
Senator Kushner votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Wong.
Senator Huang votes yes.
Senator Summers.
Senator Summers votes yes.
Senator Summers, I did not see you on screen.
Okay, I'm here. I haven't moved, so Senator Summers votes yes.
Representative Pettit.
Representative Pettit votes yes.
Representative Arnone.
Representative Arnone votes yes.
Representative Berger Givallo.
Representative Berger Givallo votes yes.
Representative Betts.
Representative Betts votes yes.
Representative Carpino.
Representative Carpino votes yes.
Representative Cook.
Representative Cook votes yes.
Hello?
Representative Dauphiné.
Representative Dauphiné votes yes, sorry.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Senator Kasser, Representative Cabros DeGraw,
Representative Cabros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Clarice Dietrich,
Representative Clarice Dietrich votes yes.
Representative Lenahan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Kasser, Representative Lenahan,
Madam Administrator, I'm going to ask you to hold the vote open for an hour, so I'm not going to have you report on the results at this point so that we can do that. And I just want to say, Representative Zupkis, safe travels. So thank you. I'm glad you were able to join us.
Thank you.
Okay, let's move on then to number 6, an act concerning deceptive advertising practices of limited services pregnancy centers. I believe that Senator Summers, thank you. Your hand wasn't raised, but I know you had some questions. Senator Summers.
Yes, I wanted to say that first, I disagree with raising this bill again for a variety of reasons. The first one is, again, I do not believe that our virtual landscape provides people an opportunity to come in person, which I think is problematic. This would be the third time that we've heard this bill. This bill brings out many people, and I went through the testimony, and 90% of the people that were testifying and stayed there very late were against this bill being raised. This bill sounds, the title is, in my opinion, somewhat inflammatory, the way it's written. There has been not one complaint on any of these pregnancy crisis centers through either the DPH or the DCP, the Department of Consumer Protection. We've heard anecdotal reports of one person having an issue, but there hasn't really been anything formally provided. These centers help or have helped over 35,000 women in the state of Connecticut, and they take not one dime of money from the state. I believe that this bill is really a general law bill. If it's about advertising practices, that's where it belongs. It does not belong in public health. And I also believe that this is a bill that is providing a solution for a problem that we just don't have. And I think we need to consider that with all of the other things that we are going to be doing in this session that are very lengthy and are going to take up a lot of time. I think it is, no one wants to see women be deceived, but it is just not happening in the state of Connecticut. And for those that have not been on the Public Health Committee, you can go back and you can look at the hearings online and see what you think in the testimony that we've had. So that's why I'm going to be a no on raising this today. And I just wanted to be clear on that. That's all.
Thank you, Senator Summers. Representative Steinberg.
Thank you, Madam Chair. I also want to remind members who've been on this committee and new members that this bill was a public health bill last time. It passed out of committee and it was voted. It was approved on the floor of the House. So there's no controversy about the fact that this is a public health bill or that indeed it merited a vote on the floor of the House. Unfortunately, the Senate didn't take it up for whatever reasons, I'm not sure. But we are simply putting through a bill that has passed out of this committee and passed the House of this state, and we are moving forward with it again. So many of the arguments you've heard today, you will hear in the public hearing, you will hear when we discuss the bill, when we're considering to vote it out. But the arguments made are exactly the arguments we heard last year and still passed it out of committee. Thank you. 2 years ago, by the way. Thank you, Madam Chair.
Thank you, Representative. Representative Pettit.
Thank you, Madam Chair. For the sake of brevity, I would say that I agree with the points that Senator Summers made, and regardless of the merits of the bill, the issue will be that will likely take up a half or a whole day of a public hearing, giving the opposition to this bill, and I'm not sure with the many things on our plates that it has priority at this time. Thank you, Madam Chair.
Thank you, Representative. Senator Wang.
Thank you, Madam Chair. I thought I was going to be in line, but nevertheless, thank you, ma'am. You know, it's an issue that I was doing some homework on and trying to understand a lot better on. And I think the point was raised that this, for those that may have led to deceptive practices, this might be a consumer protection concern and issue. And I know that the chairs want to raise it. We are going to have a discussion about it, but I'm eager to hear more about it, and I will be supporting it to learn more about it. But I will share with you one of the nagging thoughts on the top of my head is the fact that are we crossing the line in regards to the separation of church and state? Are we crossing over the line of specifically addressing faith-based organizations against the will of state government? So I think one of the fundamental tenets that we talked about is the fact that we have a democracy, but we also have religious freedom in this country. That is the foundation of the founding of this country, going back all the way to religious persecution of people leaving England to finding our country. So it is fundamental to our governance and to have that distinct separation of church and state. And as I read through this on a macro level, and I'm eager to learn more about it, I find that the specific addressing of faith-based organizations and for the state to encroach on their faith-based philosophies is something that is a dangerous path to take. But that being said, I'm eager to hear more about it, and I do want to echo my colleagues in saying that, as I said in the beginning of our organizational meeting, there are so many critical concerns that we have in this COVID pandemic. And for us as a public health committee, we should spend the bulk of our time addressing solutions and guidance and support for addressing COVID instead of a lot of the other issues. But nevertheless, I'm not the chair of this committee. We don't have the majority in this legislative body in the House or the Senate. That being the debate, I'm ready to have that debate. So, we'll have that discussion, but on a micro level, I'm going to repeat myself. Are we crossing the line between the separation between church and state? Thank you, Madam Chair.
Thank you, Senator. Representative Claire DeStitria.
Thank you, Madam Chair. What I had said before, reiterating what Senator Summers had stated, this is the third time we're hearing this. And in the last year, have we had any complaints to this issue? So to bring this concept up again, I'm just questioning as to why. But also, if we're bringing it up again from last year, why didn't we have a hyperlink from the bill from last year? I feel we should be raising this as a bill and not a concept if it's something that we're bringing up again from last year.
Thank you, Representative.
I mean, that's my question. Why is it coming up as a bill and not a concept? Sorry, question mark.
Okay. Well, I would answer that by saying that it has been some time since 2019, and we do need to look at what has happened and whether or not we will stay with the same language, or whether I would disagree with you that, when time passes, things do happen, and we owe it to our committee to examine what has happened in this area as we look at the past language and see if there's anything we would change.
Right. And as a follow-up question to that, what has changed though in the last year? I mean, we haven't received any information saying that this is, it's been a problem, especially within the last year, to bring this bill up again.
Well, that's why it will be a process. We will hear about those things in the public hearing and as we move forward in our discussions.
Thank you, Madam Chair.
Thank you, Representative. Representative Dauphiné. I'm not saying your name correctly, and if you could please tell me, it's going to take me a while.
So it's Dauphiné. You just don't pronounce the S, but that's okay.
And I apologize. I was a teacher and I should do better at this, but it's always been my weakness. So I thank you for your understanding. Go ahead.
It's butchered daily, so don't worry about it. I'm used to it. I just wanted to support Senator Summers and all that she said. And I believe that this is another controversial bill that isn't really appropriate for this virtual hearing setting. Thank you.
Thank you, Representative. Senator Kushner.
Thank you, Madam Chair. I would like to associate my remarks with Representative Steinberg's explanation. I thought it was very to the point and appreciated it. And I do want to thank the chairs for raising this concept and getting it to a public hearing. I think it's very important for us to discuss. So I support this motion. Thank you.
Thank you, Senator. Representative Gilchrist.
Thank you, Madam Chair. Yes, I also support having this bill raised as a concept. Having observed the public hearings in prior years and having myself worked for an organization that worked on this issue, I do know there's quite a bit of research done on the crisis pregnancy centers in the state of Connecticut. And so I think it's important for those new to the committee and those who've been on before to be reminded of that research. We also know that there is documentation that crisis pregnancy centers are a strategy of the anti-choice movement in this country. And so I think it's important for folks to be able to have that conversation. And I'd say now more than ever, especially during a pandemic, we should be doing all we can in the state of Connecticut to ensure that women have access to medically accurate reproductive health information. Thank you.
Thank you, Representative. Representative Kennedy.
Thank you, Madam Chair. I would echo some of the comments of my colleagues, but one of the things, I was on this committee when this bill first came up in 2019, and I do recollect we went until at least probably 1:30 in the morning with some very, very emotional testimony. And so I too would question why this is being raised as a concept bill when, as we heard from Representative Steinberg, that it went through, came out of committee, and why it's not a raised bill. So that would be my concerns. So I actually will be voting no on this bill today. Thank you, Madam Chair.
Thank you, Representative Kennedy. Anyone else care to make any remarks? Okay. I need a motion to raise this bill for our roll call vote. May I have that motion, please?
Representative.
I'm sorry, Representative Cook.
Madam Chair, I believe Representative Cook had her hands up.
I'm saying that now. Thank you. Representative Cook, I'm sorry, I did not see your hand earlier. Representative Cook?
Okay, I said I'm sorry. I understand what it's like to span over the Brady Bunch screens. I voted no against this bill last year with the understanding that there was a lawsuit that was still in place in Hartford to kind of justify some of the allegations that were happening. So at this point, I would just like to I reserve my right to vote no moving forward for those exact same reasons. I believe again in the process that things need to be heard, so I'll vote to get it out, but I will not support it moving forward unless there is any movement or change. But with those lawsuits that were taking place, it was really important that we heard what they came out of in my world before we moved forward on something that may or may not be necessary. I'm not about impinging people's rights, but I do believe that we need to look at the legal part of this as well. So right now I will vote yes to get it out of committee, but if nothing changes or I see no reason, I exercise my right to vote no moving forward. Thank you, and I'm sorry for the delay.
No, my apologies, Representative. Any other comment? Seeing none, can I have a motion to move this bill with a roll call vote? Oh, Senator Summers just raised your hand.
Sorry, I'm a little slow on raising my hand on the computer. I just wanted to let everybody know, I looked on the DCP website and Public Health, and I did not see one complaint filed against any of these pregnancy centers. And they are all listed on the DPH website if anyone is interested in looking at them. And I also just wanted to say, you know, I heard some of the language that some other folks have used in their arguments. And while I respect everyone's opinion, I think it's really important that we don't get in the middle of legislating for one group's purpose versus the other. I think we have to, you know, look at this. And when you hear this hearing again, because this will go through, because the chairs want to hear this, you will hear documentation that comes from one group. It's not scientific. It comes from one group's collecting of the information that has a, you know, a pro-choice stance. And then you'll hear from another group that is pro-life, that they have a different opinion. So the data that we have received over the last 3 years has been really anecdotal. And it's hard to, you know, put it into perspective that one group who is maybe not in favor of what the other group is doing, collecting the data, using that as evidence. There is a lawsuit. I'm glad Representative Cook brought that up. That makes this even more messy because we typically do not pass legislation while there is an outstanding lawsuit. We allow the law to go forward with their recommendations and their determination, and we don't usually get in the middle of that. So I just wanted to say those few things, and I realize that this is gonna pass, but I will be voting no.
Representative Gilchrist for the second time.
Thank you, Madam Chair. I just want to let folks know that the lawsuit has been settled and upheld, so I look forward to us having that conversation during the public hearing. Thank you.
Thank you so much, Representative. Representative Dauphiné.
I just have a question. If there were one of the legislators as part of this committee that were previously working for or affiliated with NARAL or any of those other groups, would that prohibit them from being part of this, or should they recuse themselves? It's just a question that was brought to my attention.
I don't believe so, but I'll be happy to look into that.
Thank you.
Okay, can we have a motion to bring this bill, raise this concept for
So moved.
Second.
I got Senator Haskell for the second. Who made the motion?
Representative Young.
Representative Young, thank you very much. So we are going to have a roll call vote. You know the process now. Let's give everyone a moment to get ready. And then Madam Administrator, when you're ready to begin.
Dorothy Abrams,
Senator Mary Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes yes.
Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Beck,
Representative Betts votes no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Elliott, I did not see you on screen.
Okay. Representative Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Django votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell,
Senator Haskell votes yes.
Senator Castle, Representative Cabras DeGraw,
Representative Cabras DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes no.
Representative Tardis Detria,
Representative Claritas Detria votes no.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Again, Madam Chair, I'm going to ask you to leave the vote open. I know there were a couple of people who weren't able to vote. So thank you for that. So we do not need a tally. Now I
Madam
need
Chair,
to.
apparently we may not have followed proper procedure on
No,
the,
I'm about to do that, Representative. Please allow me. I need to apologize. I did not have a motion when we voted for item 5, the act concerning healthy homes. I neglected to get a motion in a second before we voted. That's my mistake. I hope you will excuse my mistake, and I will learn and do better as we move through this process. So I would like a motion now, since we all had the roll call vote and it seemed somewhat unanimous, although we didn't get a count. If I could have a motion to do a voice vote, if that would be okay, and then we can move forward rather than going through the roll call again. So I'm going to ask for a motion for a voice vote at this time for the healthy homes.
so moved.
Representative Steinberg, and a second.
Second.
Can you say who that is, please?
Representative Young.
Thank you, Representative Young. Are there any objections to doing a voice vote for item 5, the act concerning healthy homes? I'll give everyone a minute. Seeing no objection, would everyone please get on camera and take yourselves off mute so that we can do a voice vote? And again, my apologies, and I promise to do better as we move forward. Make sure that you're off mute so that your voice can be heard. I see a couple people still on mute. So just check and make sure. All, okay, thank you. Thank you. All in favor?
Aye.
Opposed?
No.
Thank you. The ayes have it.
And Representative, just catch that airplane.
Because you are a sport. Thank you so much for your dedication. Okay, I believe we're through Roman numeral 3. We'll move on to Roman numeral 4, which is a proposed bill to be drafted as a committee bill. This bill is a proposed bill, the act concerning the certification of mental health first aid training program. It is a bill that we had started as a committee. Oh, I'm going to ask everyone to put yourselves on mute again, if you would do so, or if the host can do that for people. Thank you. This was a committee bill last session that we didn't get to for obvious reasons. This is one of the unintended consequences of legislation sometimes. We had passed a bill about mental health first aid training programs, and turns out that the way the bill is written, there's only one program or company that municipalities could use. So unfortunately, they were finding that that had some financial cost. And so we were looking at a way to broaden the training programs. And so this is something that we had already been looking into and would like to continue to look into as a committee. I think it had a lot of bipartisan support, and given the situation with municipalities now through the pandemic is even more important. So I'd like a motion to draft this bill as a committee bill. If without objection through a voice vote. Are there any objections? Oh, first of all, can I have that motion?
So moved.
Representative Arnone moves it. Seconded, Julie.
Second.
Second by Senator Kushner. Okay. Is there any objection? Okay. Give everyone a moment. Seeing none, please put yourself on camera and take yourself off mute so that we can have a voice vote to draft this as a committee bill. Please take yourself off mute, put yourself on camera. Give everyone a moment to do so. You guys are getting so good at this. Very impressive. It's only our second meeting. I congratulate you all. Okay. All in favor?
Aye.
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 Opposed? Hearing none, we'll move forward to draft as a committee bill. Thank you very much. Please put yourselves back on mute. We're moving on to Roman numeral 5, a proposed bill to be reserved for subject matter public hearing. As it turns out, we are not going to move this bill because we have found out that the legislation already exists. However, I think that, the leadership of this committee found this very interesting because what it referred to was when you go to the eye doctor, and some doctors, some people do this, some don't, but give you your pupillary distance, the PD, so that you can then order glasses at other places as part of your prescription. And so this bill was to make sure that if they do take that measurement, that you are entitled to that information as part of your medical record. And so we wanted to make sure that we looked at this. And so I'm saying this publicly, that if you are in an eye examination and they do measure your pupillary distance, you are entitled to that information as part of your eye prescription. So I want us all to know as committee members, I want the public to know, and I thank the representative, I'm not going to be able to say her last name, Representative Pettit, if you could, I would appreciate that. I thank her for bringing this forward. Representative Pettit.
Representative Zalesowski's a constituent wrote into her, and then we researched the issue and found out that Connecticut General Statutes 20-73 and 20-1286 cover what we had intended to do. So it's probably an issue of education for the public and some optometrists.
Good. And hopefully this supports that education and all of us can be messengers of that. So we'll move forward to Roman numeral 6, which is a proposed bill to be considered for change of reference to insurance and the real estate committee. I wondered if Representative Pettit or Representative Betts had any comments about this before we make that reference. Representative Betts. Representative Betts, I can't hear you. I think you're on mute. So you have your hand raised, but you're not on camera and you're on mute. There you are. Now we need you off mute.
Thank you very much. I have a question. Why is this bill being proposed to transfer to insurance?
Thank you. I'm going to let Representative Pettit answer that.
My understanding from our discussions is that 2 or 3 of these issues really involve the access in terms of eligibility, as well as the payment for these services. But our caucus had brought up the issue of whether or not part of this still should remain in public health or whether it should come back to public health after insurance evaluated the issue. So I wonder what the chair's comments to the caucus's question would be.
I thought we were referring this because the proponents of the bill thought it belonged in insurance. So if it's split, then I have no problem moving it forward to insurance and asking them to refer it back to us for portions that might be more appropriate for our committee, if that's a resolution that you agree to.
Madam Chair?
Sure, Representative Betts.
Yeah, I thank you for that offer. But if you look at the title of this and the intent of it is to examine the system of how mental health is being provided or not provided, it is not really making any reference whatsoever to payment, which should that happen, we can always refer to it afterwards. But frankly, right now, we have a mental health crisis, not just because of COVID, but ever since Sandy Hook, we've had an enormous problem, and whether it's from the provider's point of view, but more importantly, from the patient's point of view, they are not able to get their plea for help or support. And given that public health oversees and is responsible with the Department of Mental Health, I strongly believe that the Public Health Committee has jurisdiction and should be the one that has the public hearing, because it is an examination of the system.
Thank you, Representative Betts. Again, my apologies. It was my understanding that the proponents of the bill wanted it to go to insurance. So what I will say is, why don't we put it on hold for now, and we will go back and relook at it with your comments, considering your comments, and relook at the proposed bill.
Thank you very much.
Again, my apologies. Thanks for that clarification. So we will put item 6 on hold. That brings us to the end of our meeting. Madam Administrator, can you please tell us when our next the time and date of our next meeting is?
Can you repeat for me, Senator Abrams?
I can, yes.
What did you say?
Oh, I'm sorry. Can you please tell us when the time and date of our next meeting is?
I will send that out after the meeting. I don't have it in front of me right now.
Okay. We will make sure that proper notice is given for our next meeting. If that concludes our meeting, we will be in recess to leave the votes open for 1 hour from this time, to allow anyone who did not get to participate in the roll call votes or the other votes to have an opportunity to do so. Thank you so much. I appreciate your indulgence in helping us figure out this process. You have done an amazing job, and it's a pleasure to chair this committee, especially with my co-chair, Representative Steinberg. So I hope you all have a wonderful day. Thank you.
Thank you.
Thank you. Bye-bye.
Madam Administrator, this is Representative Linehan. I believe I owe you a vote.
Representative Lenahan,
I believe I owe you one vote, correct? Can you just please confirm to me what I'm voting on?
you're voting on item number 6. Just 1 minute.
Sure.
She's voting on item number 5, I believe.
It would be item number
No,
6.
Number 6.
Number 6, I apologize.
Excellent. Representative Linehan votes yes.
Thank you.
Thank you very much.
Madam Administrator, this is Senator Moore. I believe I missed the last vote.
That bill was held.
I'm sorry.
The last bill was held.
It was held?
Yes,
Thank you.
you're welcome. Is Representative McCarthy still on the call, in the meeting?
Yeah, motion approval to create consent calendar for the concepts that's aligned in
Thank you.
Madam Administrator, can you just check? This is Senator Anwar. I think I got all the votes, but I just wanted to confirm.
Just a moment, please.
Are we going to have to confirm Senator Anwar's identity? I can't tell who that is behind him.
You're all set, Senator Anwar.
Thank you.
Madam Chair, I'm going to move on to another meeting.
Thank you. I've already done the same. I'm in another meeting now. Thank you.
Madam Administrator, I tuned in a little bit late, but I think I got all the votes. Is that correct? This is Representative Ryan.
Yes, you did, Representative Ryan.
Thank you for your accommodations, ma'am.
Hi, Lindsay.
Henry, you're all set too. We have your votes.
Thank you.
See you later.
See you, Lindsay. Lightning Lindsay.
Lindsay, if you have a way, Lindsay.
Yep.
If you have a way to contact Representative McCarty, I'm not sure if she missed a vote.
Yep, she missed just one.
Yeah, she's in education, but if you can just let her know that we held the votes open so that she moves over and does this. Thanks.
Yep.
Lindsay, can you also check with Senator Kasser? She wasn't in the meeting.
Yep, I'll text her Reed too.
Thank you.
I texted Senator Kasser, but didn't hear back. But if you could do so as well, that'd be great, Lindsay.
Okay.
Beverly? Hi,
Hi, Senator. Hi, how are you?
I'm okay, thanks. How are you?
I'm well, thank you.
I just wanted to log in and vote, please.
Okay, we took a voice vote on an act concerning healthy homes.
Senator Kasser votes in the affirmative.
Thank you. On section 3 of the agenda, an act concerning deceptive advertising practices of limited service pregnancy centers. How do you vote?
In the affirmative.
Thank you. We held item 5. We held the bill on the section 5 of the agenda. And we held the bill, House Bill 5073 on the section 6 of the agenda. So we held 2 bills. And the other bill was a voice vote, so you're present, so your vote is taken.
Yes.
Thank you very much.
Thank you so much, Beverly. Take care.
You're welcome. Bye-bye.
Bye.
So Lindsay, we're waiting for Representative McCarthy.
Yep.
Okay. Okay.
Oh, Beverly. I can't thank you enough. I am, can you hear me all right?
Yes, I'm hearing you.
I am hopeful that I'm going to make it through this virtual platform. So I got on education and I had to be there. So then I tried to get you on my phone and I could see you, but I couldn't. So please forgive me and thank you for keeping the votes open. I really appreciate it.
You're welcome. Item number 6 under section 3 of the agenda, an act concerning deceptive advertising practices of limited services pregnancy center. How would you vote?
Yes, I vote no on that concept.
Thank you. Everything else we took voice.
Everything
vote,
else
so-
was the voice, and that was fine. Luckily, education went very quickly.
Oh,
So
they
I was
did.
able, yeah, it's a little different over there. So we got back, I was able to get back, but I'm gonna try to run the, I'm worried because during education, actually, we could hear Senator Abrams talking here. So I think she came in, but we could still hear some of public health going on. So I think we're gonna all try to figure it out. What if I had the computer if I ran 2 at once, but how would you do it? Just mute it and put it in a different part of the room, maybe?
I think that it's possible to do it that way.
Yeah.
So you're
'Cause I
not
know-
getting a feedback.
Jumping on and off for me, I get a little nervous. I like to make sure that you keep the connection, so. But you're wonderful. I thank you and welcome to Lindsay.
Yeah, Lindsay tracked you down.
Yes, she did. And I'll try to be better going forward. So thank you very, very much. And I hope you have, I'll be happy when we're all back in the real world again. Thank you. Thank you. Have a wonderful day.
You too. Bye-bye.
Thank you.
Bye now.
Hey, Lindsay, I'm going to send you the schedule for the rest of the session. It's really tentative because it could change. And I'm going to ask you to send it to all the members. Okay, so I'll send it to you like in maybe 20 minutes because it's 2 different schedules, one for leadership and one for regular members, because the leadership schedule will have other meetings on it. So I'm going to fix it and I'll send it to you shortly. Thank you. Bye, guys. I'm gonna get off so I can do stuff for the 2 p.m. meeting today.
Okay, and then I just close it. I can end this at 11:10.
Yes.
Okay.
So she said 1 hour, so
Yep.
it's 11:10. Yeah.
You got it.
And if anyone comes on to vote, just text me.
Okay.
Just ask them to wait a minute and text me. You know what? I'm just gonna minimize. I'm not gonna close it out.
I've got
Alright?
the vote. I've got the vote tallies too right in front of me, so it's fine.
Okay.
And Lindsay, I'll send you all the people that were in the meeting because
Yeah,
I did.
So-
I do have that. So
So it looks like we have everyone because Bev, you said we can count Casser.
Yeah, she came in. She voted.
Casser came in.
Yeah,
Okay.
she better vote. So it looks like we have everyone.
Okay.
Okay.
Okay, so
See you too.
see you too.
Yeah, Cass, you can hop off too. No need to wait around.
Okay. Yeah, I took quite a few notes, so I think that I won't. The minutes they'll probably be pretty easy.
Okay.
So I'll probably have them done this afternoon.
Sounds good.
Do you want me to send you what I've got, Cass?
Yeah, if you still want to
Okay.
send that over, that'd be really helpful.
Okay. All right, I'll do that.
Great. Cool.
Okay.
Thank you, guys.
Take care.
Yep.